We start the news from the University of Ghana, where on Thursday, investigative journalist Anas Anas was literally put in the dock and cross-examined by members of the academic community, lecturers of law, journalism, political science, philosophy, and sociology. The team interrogated the methods, ethics, and legality of works of the investigative journalist. JoyNews' Mino was there and now reports.
In the over 2-hour session, the investigative journalist was bombarded with questions from students, media practitioners, lawyers and lecturers. Even before the panel spoke, he defended his work.
Let me make it very clear that nothing has changed. Methods, everything from the judges scandal, from the Osu Children's Home scandals is same. We have not changed anything. Undercover would always remain the last resort. Where the conventional camera cannot work, that's when we look up to undercover. And I must say that we strictly abide by the BBC Ofcom rules before we decide that we are coming in to do an undercover piece. Our prima facie evidence would have been in place. We have weighed it. We think that the public interest outweighs everything.
Anas says he's unfazed by the threats and attacks on him following the release of number 12. On the legality of his work, Dean of the Faculty of Law at GIMPA, Kofi Abuchi, says the approach of Anas is permissible under the law.
The media rights, Anas is performing a constitutionally recognized enterprise. Anas is allowed to do exactly what he is doing. It is my submission that the practice of investigative journalism as Anas is practicing at the moment doesn't fall under any of the known exceptions for the suspension of the right to practice journalism.
He also addressed the controversial issue of entrapment by Anas.
Over the years, and this is not only in Ghana, in many jurisdictions, entrapped accusers, or rather accused persons, entrapped accused persons are usually not as protected by the law as other accused persons. So entrapment is accepted. Evidence gotten through entrapment is accepted and admissible in court. And so when it comes to entrapment, in many cases, they're unjustified means. And the reason is because these offenses are consensual offenses in respect of which the state has a huge difficulty in catching perpetrators.
But philosophy lecturer Nancy Bafo-Jemfi questioned the ethics of what she calls sponsored undercover journalism.
I want to ask, if I want to correct wrong, and I think we are all agreed on that, we want to correct wrong, moral wrong. If it's a legal one, we know the way to go. I will have an issue ethically. This is an ethical discussion. Ethical, sponsored wrong seeking or wrong exposure. Secondly, remunerated, any form of remuneration for exposing a moral wrong.
Even though he set out to investigate football, the documentary also borders on politics and corruption. In view of that, political scientist Dr. Ansari said it was important to adapt innovative ways to uncover the sophisticated forms of corruption in the country.
The fight against corruption has been a big fight for government to handle. But here you are, an individual from the media comes up to take these things up.
But why number 12?
First of all, the political side of it that had 5 million, 3 million, 2 million, 1 million, and another 1 million equates to 12. It's 12 million. That's one. 2, Kwesi Nyantechi was on the 12th floor.
This numerology.
Was on the 12th floor of the hotel where the incident happened. The third aspect is that football is a game of 11. Once you introduce another hand, it's 12. And that 12 can only be criminal.
I told that he didn't believe me. And that this guy.
Mino for JoyNews.
Elsewhere, prominent Ghanaian lawyer and member of Council of State Sam Okudzeto has joined in calls for the decriminalization of petty offences in the country. Mr. Okudzeto believes this will eventually lead to a reduction in crime rates. He made the call on the sidelines of the launch of a research report on decriminalizing and declassification of petty offences in Ghana by the Commonwealth and Human Rights Initiative.
The report, which captured the views of respondents, identified offences such as petty stealing and other minor crimes as placing undue pressure on the country's criminal justice system. The report also suggested alternative sanctions such as probation, rehabilitation and fines instead of imprisonment for such petty offences. Speaking at the launch, renowned lawyer and member of the Council of State, Sam Okudzeto, is of a view the criminalization of petty offences places undue pressure on the criminal justice system.
We say that when you decriminalize petty offences, your crime rate actually goes down. We say that nobody is saying that don't punish them. You can always put society, you can also put things in place that can punish them. We have traditional system for resolving disputes, which does not involve being incarcerated. And I think we can revive those to work. So the challenges are simple because those who are supposed to initiate the change are not doing it. That's what the whole issue is about, because we have a law reform commission. I'm aware that they made certain proposals for change. Some of them are lying down there. Attorney General will say that it doesn't have a staff or money. If you go to your local government, lawyers are not even there. And yet they are also making so many rules and laws where they are punishing people. For example, you see refuse everywhere that we are all complaining about. The question that matter can be solved actually at the local level without the court system at all.
Meanwhile, Regional Coordinator of Commonwealth Human Rights Initiative Africa, Mina Mensah, believes the implementation of the recommendations in the report will promote fair legal representation for the vulnerable.
If people are able to get access to legal representation, the problem will not escalate. Now, we thought that we can't just get up and say that declassify, but we can start by doing a research into the kinds of laws that we have in this country, which of them we think can be declassified and decriminalized. And we spoke to a wide range of people. And that is what we have put together as a research report and added recommendations to it. And this we intend to present to Parliament, Law Reform, the Aegis Department, to encourage and to guide them to look at our legal system, the criminal code, and see what kind of reforms they can bring to bear in those documents and ensure that people are not people's rights are not unduly abused because of the way our laws are framed.
The report presents another opportunity in decriminalizing and declassifying petty offences and also effecting reforms in the criminal justice system.
Now, Parliament has issued a one-week ultimatum to the Greater Accra Regional Hospital and Lekma Hospital to furnish it with details surrounding the death of a 70-year-old man. The death of Antonio Pokwe-Champong sparked anger on both social and traditional media after several attempts to seek treatment at about 7 hospitals failed, with the explanations that there were no available beds. Chairman of the Health Committee, Dr. Kwabena Chumnyama, has been speaking to my colleague, Kwesi Parker-Wilson.
To indicated some institutions were involved. So we've written to them, we've given them a week to furnish us with a report, if you like, on the incident. You know, what we have is presentation from the relatives of the patient. So we need to also know the side of the hospitals or the institutions. We also written to the regulators, Medical and Dental Council, Nurse and Military Council, for them to also give us, you know, a view on how the doctors and the nurses involved conducted themselves in their case, whether in their opinion they conducted themselves properly or not, so that we will be able to have a basis to interrogate the issues further. We will subsequently speak with other professionals in the area of emergency to try and give us some recommendations as to how we'll be able to solve this challenge of no bed. But we need to come up with some far-reaching policy direction which will help solve this problem nationwide.
Right. Now, Honorable, you were saying that you're already written letters to the institutions involved. I believe there's 7 institutions involved. Right. Now, is there a way that, or is it possible that you're going to even invite them to the committee meeting to even come and explain what it is?
That is what will happen. We would
use someone there.
Of course, we want them when you are coming, because we need to get some documents so that we'll be able to know the relevant questions we have to ask you when we meet them. So obviously, they will all be summoned to the committee, but of course, we have to get some source documents that will help us with our investigations.
Away from Parliament, authorities at Atimpoko in the Eastern region are appealing for support to make it or their health centre complete. The facility is in dire need of beds, materials and equipment that will make it a well-resourced centre. Assemblyman for Atimpoko electoral area Nanayao Ampim Dako says this is a sure way of providing quality healthcare to the people of the area. Here's correspondent Kwame Yanka.
Atimpoko is the district capital of Usujaman in the Eastern region. Before the health facility was relocated to its current location, it was relying on storerooms spared by residents to care for patients. The new facility, which took about 7 years to build, is incomplete, contrary to what the previous administration claimed. A portion of the ceiling is not fixed, leaving the wires exposed. Nanaya Wampindaku has been speaking to JoyNews.
We urge them to also look down to us, to ensure that whatever project that has been started is completed and people enjoy it. When they begin to enjoy it, then they will understand that there's a change and improvement in their life. By looking at the situation, what we have as a district capital, I'm sorry, the assembly is just a stone throw from here, and you can see what we've been struggling for it for over 7 years. Where they were occupying some stores down there, which is not the best. Whatever the situation is, they have to come thinking that things will change, but it's the same. It's even getting worse because the population patients keep on increasing. So we use this medium to appeal, I'm saying especially to the first and second ladies to come to our aid, because we know what they are doing. Whatever they've gotten for Kumasi, they should also bring some to Atimpoko, so the district capital. We are in dire need.
He added some nurses have to rely on torchlight due to the poor lighting system to carry out their duties.
You have a midwife here, so delivery ward, there's nothing there. So if you talk of delivery ward, there will no kind of equipment. If you talk of the maternity room, there's nothing there. Even the OPD detention unit, you've seen there's only a single bed. At first it was a wooden bed, and even the lighting systems are not complete. According to some of them, they have to even use their phones to light the light of their phones to take care of certain patients. So delivery, maternity, and detention room. So these are areas when it's improved, that at least then we can see a change. So these are areas that we appeal for them to come and assist.
Meanwhile, the Sojaman District Chief Executive Samuel Ejekum has assured the facility will be completed within his tenure.
We still need to do some work on it. We have provided in the 2018 budget. So we expect that this year, 2018, some work will be done on it. We hope to complete it fully this year. It is our responsibility that all the health centers in the district operate and operate well.
All right, that's it for the AM News. For now, we've got the newspapers and we will go online. It's a holiday, so I think we have just about 3 newspapers in the studio. So we'll do more online review this morning. Kojo, here's some music from the Harmonious Choir. We'll come back and we will do the newspapers.